Whether you're new to health insurance or an old pro, things are really going to change in 2014 with the enactment of the Affordable Care Act. Hello, I'm Mark Deshane, and spanning the last 4 decades, my agency has provided people health insurance to families just like you and small businesses. In the next 2 minutes, I'm going to do a high-level overview of exactly how to navigate this and how to survive this healthcare mess that's being forced upon us. Okay, first of all, what's happening? In 2014, health plans are going to be forced to cover maternity, chemical dependency, alcoholism, drug abuse. These are all great things. They're going to have reductions in your total out-of-pocket to $5,950. That all sounds great, but the Wall Street Journal has put out an article recently that says this is going to increase premiums 65 to 100%, doing the exact opposite. There's the Affordable Care Act, and here it is doubling premiums. So if you're like most people, you're going to be really scratching your head wondering, how am I going to pay $1,100 to $1,500 a month for health insurance when you're struggling to make ends meet as it is now? So what is the problem? The problem is you're either going to be forced into a plan that you can't afford, or you're going to be forced into not having coverage. I'd like to offer you an alternative in the middle. We all know that the government may or may not subsidize you based upon your income. If you visit my website and use a virtual agent, you'll know if you get a subsidy. And if you are getting a subsidy, great. We'll help you find any of the major carriers and take care of that insurance for you. But if you're like most people who are just a little bit too successful according to the government, you're not going to get any help with these greatly increased premiums. And that might be putting a strain on your budget. So rather than being uninsured completely and putting yourself entirely at risk, we have 2 options to protect you that you probably haven't even seen anywhere else. Option number 1 would be Assurant Health, solid company, been in business since 1892. They're offering the real PPO network with guaranteed pricing and a fixed benefit level that helps you pay your bill. And option number 2 would be a pre-Obamacare short-term medical that's stretched out to a year at a time. Both of these alternatives are affordable, provide your family coverage that certainly is better than not being covered, and gets you out of paying these high $1,500 to $1,100 monthly premiums. I'd like you to use our virtual agent on our website and get started exploring so that we know what's going on with your family. And then one of our agents or myself will call you and personally assist you and give you the things that you need. Thank you so much for your time. I look forward to hearing from you.